Hello, everyone, and welcome to today's webinar, Drive Down Costs. I'm Jenna Westenberg with HealthCheck 360. We have a great presentation for you today, but before we get started, I'd like to take care of a few housekeeping items. We will have time for questions at the end of the presentation. If you have any questions at all, please type them into the question box in the lower portion of your control panel. We will also be posting a recording of this webinar online, so if you'd like to replay this at a later date, it will be available. Also, if anyone would like a copy of the presentation, please send an email to me or type your request in the question box. Today we have Jessica Mandot and Trent Tangen with us to talk about a coaching solution designed specifically for drivers that can help companies save money and improve the health of their CDL holders. Now I'll turn the presentation over to Jessica.
Thanks, Jenna. So really what we wanted to share with you today is our new driver coaching program. We're going to talk through the value that it provides to clients, or if you are a transportation company, to your drivers and to you as a company, and then the results that we're experiencing with the clients that have implemented this program. So for those, again, that are familiar with this space, you all know that the #1 concern facing trucking companies in the trucking industry right now is that there's a huge driver shortage. I think it's estimated that about 63,000 drivers are needed right now in order to fill the loads and the fulfillment that are taking place in that industry. And then in addition to that, there's a 90% turnover rate within the driver community. And so it's just a really huge problem that trucking companies are facing today with having loads that are currently filled with supplies but have no one to drive it and get it to its end place. So that, of course, includes lost money for companies, lost revenue. And then #2 is just an issue that's facing the transportation industry as a whole, and that's driver health. And we all know that some of the most unhealthy individuals are truck drivers. So some of the stats showing there that the obesity rate among drivers is double that of US adults. The nicotine rates are 3 times that. Sleep apnea rates are 4 times. And diabetes is not quite double that to just a normal US adult. Knowing that getting a CDL license is extremely important and necessary in order to drive, because individuals are unhealthy, it's leading them to have more frequent medical examinations. So individuals that are less healthy, we're seeing that about 3% of drivers are temporarily disqualified from getting their CDL altogether. About 5% of them are not even getting a 3-month or a 6-month CDL. And so it's, again, adding to our concerns and the issues in the industry of not having enough drivers on the road to haul the trucks that we have. Second piece, again, increased turnover. That being related to poor health, about 21% of drivers report that health issues are the reason for their turnover. So if we can prevent individuals from having certain health issues, helping them have a better quality of life, we're expecting to see that a number of them will continue to stay in the industry and not disengage due to health reasons. #3 is going to be higher crash rates. So poor health leads to higher crash rates. And with looking at just obesity alone, it doubles the crash rate of an individual that's in a healthy weight. Looking at some specific pieces with crash rates, that's also impacting your work comp as well. And I'll talk about that on the next slide. But you're 2.6 times more likely to have a DOT reportable crash with individuals that have 3 or more medical conditions, and that only increases with the more comorbidities that an individual has. #4, poor health leads to higher work comp claims. So I had mentioned that before, but really what that means is that your likelihood of incurring a work comp claim or having some sort of safety issue is going to be higher if you do have more comorbidities. So thinking about an individual that's overweight or obese, getting in and out of a truck every day, they're more likely to have a back sprain, more likely to have an injury. And then the intensity of that injury is also going to be longer and more costly. So an individual that's a healthy weight is more likely to come back to work quicker than an individual that has diabetes, is overweight, has hypertension, and so on. And And then the last piece, and I think the one that we most commonly think of with having a healthier population and being able to help improve the health of our drivers, is how that impacts our medical claims. And so obviously having a healthier individual, someone who's compliant with their chronic conditions if they have one, is going to be less costly than an individual that's unmanaged, overweight, and has some of those comorbidities. So Health Check 360 sat down, and knowing all of these issues and knowing that a number of our clients are in this transportation space, we really wanted to sit down and focus on a program that's going to support these clients and these drivers. And so what we did was we worked with a team of transportation experts and clinical staff to create our driver coaching program. And so the goal of this was really two different components. The first being to help these drivers achieve a longer renewal on their med card. So it's very focused around helping individuals to renew that med card. If they're on a 3-month, we want to get that to a 1-year or a 2-year renewal. If they're on a 6-month, again, we want to get that to a 1-year or a 2-year renewal. Of course, for the obvious reasons that I had mentioned previously. And then the second goal is specifically geared to helping them live a healthier lifestyle, improve their quality of life, and get home safely to their family. So kind of a twofold value in terms of what this program will bring to the employer and to the drivers. So specifically, the intervention model that we have for this driver coaching program is we break individuals up into 3 different categories. So we're looking at drivers specifically that have only been renewed on a 3-month level, a 6-month level, or a 12-month level. And the program is going to vary and be very specific to that individual based on which of those 3 categories they fall into. And so the 3-month is going to be a more intensified coaching program over a shorter period of time, helping work with that individual on a regular basis with the goal to be 3 months from now at their next DOT physical to get that CDL renewed for longer than a 3-month period. And then again, for those that are on a 6-month renewal, working with them 10 times over that 6-month period to help them for their next renewal to get that to a 1-year or 2-year, depending on what their conditions are. And then for the drivers that only have a 1-year renewal, helping them to get that to a 2-year renewal. So very specific goals for each one of those programs. And then in addition to the health coaching components that come along with that, they're all completed, all of the calls are completed with a registered nurse. And in addition to that, we're sending some tracking tools that are going to support them and give them those resources to help them monitor and track their progress over time. So the most common reason that drivers do not renew their CDL is because of blood pressure or hypertension reasons. And so for those individuals, we're going to send them a blood pressure monitor or blood pressure cuff. If diabetes is the reason, we're going to send them a glucose monitor. If it's because of obesity or some other metabolic syndrome or other issues, we're going to send them a scale, a pedometer, etc. Tools that are going to help them to renew that and track their progress over time. And in addition to that, what we found is when talking with the drivers and introducing this program, they tend to use their DOT physical as their annual checkup. And our goal is to change their mindset of that. And instead of using their physical as their annual preventative visit, what we're finding is that they're not doing anything in between each one of those physicals. So our goal is to help almost train them and retrain their mindset so that we're prepping them for their next physical. So we're building that preparation aspect. We're giving them that regular support and monitoring in order to see progress over time. And then in addition to that, providing them the nurse, which is going to allow us to do that accountability and education aspect as well. So the answer to the 500 level question is really what's in it for me, right? So the value to the driver and the message to the driver is that it's going to help them improve their quality of life. It's going to help them increase their safety and reduce any risks of accidents. Not all, of course, but reduce those risks and mitigate those risks of having an accident, which of course is going to potentially put them out of a job or not on a full paycheck for a period of time. And then in addition to that, allowing them to be more likely to renew or extend for a longer period of time their CDL, which again is going to keep a paycheck in their pocket. So those are some of the key takeaways and some of our sales pitch that we provide to the driver when our coaches are engaging in these conversations. And then the value to the employer. So I touched on a couple of these previously, but helping to reduce those turnover costs is really going to allow us to save money for the company as a whole. Getting the drivers on the road, keeping them on the road, reducing any costs associated to the health plan for them being unhealthy or not managing their condition, and then also just the frequency of incurring claims for each one of those physicals that they have to do throughout the year. And reducing the liability. So as I mentioned before, reducing crash rates, reducing work comp claims, and really helping to impact the bottom line for our clients. So I'm now going to hand it over to Trent, who is our Director of Health Coaching, to talk through a specific case study and the results that we've seen with rolling this out with some of our clients.
Yes, thanks, Jess. So again, my name's Trent. When we developed this program and we're talking about it, we wanted to test it, of course, and so we were able to work with a large company here in the Midwest of over 1,000 employees, long-haul drivers, and we asked them to, would you be willing to let us try this out on a handful of drivers that have a 3 or 6 month med card. So we're going to talk through those outcomes here. And one of the first questions we had and that we wanted to uncover was, are we going to be able to get a driver to engage? Meaning, do drivers care enough? Will they complete all the phone calls? Will they actually be working with our registered nurse towards their goals and towards improving their health? Do they care enough? And without a doubt, the answer to that is yes. So we learned that the drivers, they do want to be healthy. And not only that, they were very, very thankful for the support. Now, not all drivers started out that way. Certainly a couple of them were guarded. And it took 2 or 3 calls for them to develop that trusting relationship with the nurse. But after that, they were coming back to the calls, excited to express the progress that they had made towards improving their health. Another lesson learned was lack of knowledge is really a big issue. So we still have cases where people think that drinking a sports drink is a healthy choice. And we need, educating them on the amount of sugar that's actually in that sports drink and helping them to switch that over to water or black coffee or something like that. And then outside of knowledge of what is the healthy choice, when people do make a change, you'll certainly have these drivers that are sick and tired of being sick and tired. I want to make a change. They've heard all the things that they're supposed to do in the past in terms of exercise and quitting nicotine and stress management and nutrition and doing all these things, but they tend to bite off more than they can chew. They want to make good results. They're making that decision for a good reason, but it's too much and it's not sustainable. And so we find that we can help these drivers to make 1 or 2 small changes and then build on those throughout the program that we can get to some big results. And I'll share some of those results here in the next coming slides. And then the last one, Jess mentioned this earlier, is needing the support to advocate for themselves regarding their medical needs. So, not waiting for that DOT physical to determine if they need a change in blood pressure medicine or need a new or a adjustment to the diabetes medication. So coaching them throughout the entire process. So let's talk about some outcomes. We've got 6 drivers that we're going to talk through here at a high level. Driver number 1, when he came to us, he had a 3-month med card, and then he was able to renew with a 2-year renewal. So he got the max renewal date. His initial short card was due to his blood pressure, and you can see the reading up there that this driver was getting. And our clinical team worked with him on small changes in nutrition, primarily around reducing carbohydrates, and he started a regular exercise program. He was able to get his blood pressure down enough and show that it was stable enough to where when he went back for the physical, he got himself a 2-year renewal. Driver number 2 went from a 3-month med card to a 1-year. So his initial card was due to diabetes, and you can see in that 3-month period, his A1C came down a full point. That's massive improvement in a short time. His big thing was going back to the sports drinks I mentioned on the previous slide, helping them to reduce the energy drinks and sports drinks and replacing those with water and black coffee if the extra caffeine was needed. And then just starting a simple regular exercise program around the truck at the truck stop. Driver number 3, he went from a 3-month med card, and then after working with our clinical team, got a 1-year renewal. So this driver, his initial short card was due to his blood pressure. And look at the great changes in his blood pressure that we were able to document with this guy. His blood pressure on his medical report was 165/92. And when he was checking his blood pressure and reporting back to our team, he was in the 130s/70s. So a massive change, a massive reduction in risk for heart disease and heart attack and stroke. During that time, of course, lifestyle habits that he made to improve his blood pressure also helped him to lose 15 pounds. His focus was on increased lean protein and vegetables with each meal. A couple more examples here. Driver number 4, a 3-month renewal, and he was able to earn a 1-year renewal. His initial short card, again, due to blood pressure, by the time our nurses were done working with him over that 3-month period, his blood pressures were down to that of a healthy adult, so in the 120/78 range. Primary focus for this driver was reducing processed food and stocking his truck with healthy snacks and replacing soda with water. So, you see that theme throughout, is replacing the carbohydrates or the sugar or the refined and processed food with water, with black coffee, and with some lean protein and veggies. Driver number 5, now this driver had a 6-month, and he went to another 6 months. Don't like to come up with excuses, but I do want to state that this driver, we started working with him just 3 weeks prior to when he had his renewal. But in that 3 weeks, his A1C reduced a full point, and he lost 8 pounds. And that was primarily, again, around reducing sugary drinks and replacing them with water, and starting to walk around the truck. And this driver started to use a pedometer and tracking his steps. And then we have one more driver who's set to renew here in November. Started off with a 6-month med card due to diabetes, but so far he's been able to bring his fasting blood sugar levels from the upper 200s to 300 down to 120. So we're really optimistic that this driver will get a 12-month med card, but more to come on him. The success for him is coming from stocking his truck refrigerator with fruit and replacing chips. So what you can see with the drivers is really small changes are the key to success. One might think that these guys are, because their health is at such a high risk that Jesse alluded to earlier, that you need to make a lot of profound changes in order to get them down to that of a healthy adult. And that's simply not true, and it's also not sustainable. So by developing relationships and our nursing team being able to work with the driver, understand what those risk factors are, and making 1 or 2 small changes and progressing on those weekly goals throughout the duration of the program, you can see that we were able to get some outstanding results.
Yeah, and I think that brings us back to a couple of points where we understand that a traditional wellness program is not going to work for the majority of the transportation clients out there. And so something like this really allows us to target a very core issue with these transportation companies and the concerns that they're facing in their industry, but also create a program that's specific to that driver and focuses on the needs of that driver. I think on all of those 6 examples, the majority of the things that they focused on and the areas of interest and the specific behaviors for each one of those drivers was very different than all of the rest of them. And so our team is mainly focused on, let's start with where you're at today. Let's learn more about what your day-to-day behavior and lifestyle looks like. And then make some small changes, as Trent mentioned, to really focus on what we can do for you as an individual person and creating a personalized game plan for that individual. And so just a kind of a quick recap, the program goals and where we started was really to help retain drivers, help keep them on the road, make employers more money, reduce crash rates and work comp injuries that do result in significant costs for the client, reduce healthcare costs associated with each one of these conditions and having comorbidities, being overweight, those types of things that we know drive costs within the health plan, and then improve the quality of life for these employees. We know that it's on the top of their mind, safety and coming home to their family and making sure that they can go back to work every day and get a paycheck every day. So making sure that we can improve that quality of life for these employees. And I think some of the other things that we've learned is that the drivers are going to be skeptical at first, and we'll be the first to admit it, but it's really helping them understand what that value is to them. And what we found is that after going through a couple of initial prep calls with the drivers, all of them were really excited and engaged throughout the duration of the program. So they saw the value, and it also helps relate that back to the employer, that the employer cares about me, they care about my safety, they care about my health. So we've had some tremendous results, some great feedback from both employers and drivers with this program. And we would love to hear from all of you if you have any questions, any specific groups that you're working with, or if you are a transportation company that's interested. We'd love to hear what questions or feedback you have.
Great, thanks, Jessica. So just a reminder, everyone, if you do have a question, please type that into the question box on your control panel. It looks like we do have a few questions here. How does a driver enroll in this program?
Yeah, that's a good question. So that's the short answer is our team can facilitate all of that. So if you provide us with a list of drivers and their med card duration, we can manage that outreach. So we can set up some information that goes out and some flyers to help drivers know that to be aware of this, of the program, and so that if they do get a call from Health Check 360 inviting them to participate, that it's not a surprise to them. So we can manage that entire process on our side.
Okay, great. Is there a minimum enrollment required for this type of program?
So no, with some of the clients that we've rolled this out to, they wanted us to only focus on their 3-month and 6-month individuals, and so they know who those individuals are because they have to collect the CDL and DOT information, and so they send that to us, and we proactively reach out to the individuals that they're kind of qualifying as eligible. Some clients have chosen to do 3, 6, and 12 months. Others just want to focus on 3 months. So those are definitely some things that we'll customize client by client.
Do you need to be a health check client or have any type of wellness program in place to do this particular program, or can you do it kind of standalone?
Yeah, so as I mentioned before, we know that wellness is one of those things where it's not a one-size-fits-all. And so because of that, we have created this to be a standalone program. We don't need any biometric information to provide our services specific to the driver coaching program. You don't need to have the My Health Check 360 portal or our other services. This can be a standalone that's specific just for what the client's looking for.
Okay, great. It looks like those are all the questions that we had today. So I do want to remind you that all attendees will receive a follow-up email with links to the presentation recording and contact information. This concludes today's webinar. I hope everyone enjoyed the presentation. In the meantime, be sure to subscribe to our blog and follow us on social media for the latest on Health Check 360. Have a great day.